As of today, some state payments to healthcare providers are on pause. Governor Mills warned that would happen if the legislature did not pass the supplemental budget with that 2/3 majority. Well, last night the House got 2/3, the Senate did not. Good evening, I'm Brian Yacono.
And I'm Amanda Hill. While those payments are on pause, the chamber will once again meet tomorrow morning to tackle the budget issue. Donovan Lynch is tackling the developments in Augusta.
This bill fails passage to be enacted.
In Augusta, all eyes on the fate of the supplemental budget.
I never want to count something as over.
We just need to get this done.
The bill, which would cover a $118 million funding gap in the state's Medicaid program, failed in the Senate amid Republican opposition on Tuesday. This coming right after the House passed the legislation, crossing the 2/3 bipartisan majority needed for it to take effect right away. Now, Republicans in the lower chamber are questioning the move by their colleagues in the Senate.
My initial reaction is obviously disappointment. I was hoping that we would finish up the supplemental last night.
State Representative Jack Ducharme serves as the ranking House Republican on the powerful Appropriations and Financial Affairs Committee. Though he's calling for Medicaid reforms that would cut costs, when it comes to backing a bill that would address a funding gap in the program, he says the cue for House Republicans came from the voters.
We're in rural areas where there's a whole lot of Maine Care recipients, and we're all getting calls and letters from our constituents saying we really need to pass this.
Now, with the insistence of the House, the Senate is set to take up the budget one last time on Thursday. But there's little evidence the result will be different as both parties stick to their guns. In a statement Wednesday, Republican Senate Minority Leader Trey Stewart writes, quote, "I have made it very clear to my Democratic colleagues that without substantive welfare reform, there would not be enough votes for my caucus to ensure 2/3 passage of the budget in the Senate."
I want to be very clear that the amendment in front of you...
Democrats are dug in. After receiving broad GOP support for an amendment with concessions to Republicans like limits to general assistance money for housing, Senate President Maddie Daughtry has made clear that was her last offer.
You can't keep coming back with a list of demands over and over and over and over again.
Ahead of the vote, some Senate Democrats like Joe Baldacci are already preparing for the bill's ultimate defeat.
So we have to make a final vote. And at this point, I would consider it making a respectful burial unless something dramatic happens.
I disagree with Senator Baldacci.
And the Senate will reconvene to take up the supplemental budget on Thursday at 11. In Augusta, Donovan Lynch, News Center, Maine.
And Governor Janet Mills issued a statement today about the legislature failing to enact the supplemental budget as an emergency measure. She says Senate Republicans turned away from the bipartisan agreement, unlike their House counterparts, and in doing so are causing harm to Maine healthcare providers and patients. She goes on to say Maine DHHS is now going to have to cap payments to healthcare providers because of the obstruction from what she says were GOP senators. State police investigators spent the day at a home in Palmyra, but they are not yet saying why they were there. The home is at 531 Madawaska Road. In addition to 6 cruisers, there was also an evidence response van. We did contact state public safety officials for more information. All they could tell us was that there was an incident at the home that was being investigated.
The U.S. Department of Agriculture announced today that it is ending 2 pandemic-era programs that provided locally grown food to schools, including some in Maine, and food pantries like the Good Shepherd Food Bank. And the cost of those nationwide programs was $1 billion a year. That comes on the heels of last night's announcement that the Department of Education has fired half of its Washington staff with the intent of shutting down the agency. And that has educators here in Maine worried. The DOE currently funds several sectors of education, from preschool programs to school lunches. Then there are outstanding student loans. Lenders in Maine say if you have a question about your loan, reach out.
So I think maybe the day-to-day could change a little bit. And certainly a student's financial aid office is going to be a great source of information about how it might impact them on that campus. But I would say be patient. It's a very busy time.
A spokesperson for the University of Maine system says they are still waiting for more information to better understand what the impacts there could be for those in higher education. For some, it seems like yesterday. For others, a lifetime. Today, though, marks exactly 5 years since the first positive case of COVID-19 in Maine was announced.
It was a time of uncertainty because the last time Maine or even the world experienced anything remotely like it was the Spanish flu a century earlier.
The individual who tested positive, presumptive positive, is a woman in her 50s who lives in Androscoggin County.
Governor Janet Mills and the state's top health officials confirmed Maine's first COVID-19 case on March 12, 2020.
That individual is quarantined in her home.
Until that day, Maine had been COVID-19 free, but was preparing for the outcome that was sure to come, which it did. And with it came a new lexicon, at least new to those outside the public health field. Terms like contact tracing, social distancing, remote learning all became part of our daily lives. Handshakes and hugs gave way to rubbing elbows. And what began as a suggestion that large gatherings would not be a good idea,
250 or more people for the next 30 days. This is a recommendation, not a mandate.
would soon turn into one as the virus spread through families and communities.
The strongest tool that we have in our kit is to prevent individuals from coming into close contact with one another.
Then, 9 months later, came the promise of a vaccine, which offered hope to most people, but for others was a target of suspicion.
Coleslaw would be great.
5 years after that first day, life looks a lot like it did before we ever even heard of the coronavirus. But the battle against COVID-19 is not over. In the past 12 months, 238 of your fellow Mainers have died with the virus in their system, 12 of them during the second week of January 2025 alone.
We here at News Center Maine will be bringing you stories about how far we as a state have come since those first days of the pandemic, the lessons learned, and the people whose lives have been affected to this day. We'll be bringing you those stories in the days and weeks to come. Now, despite the millions of lives the COVID vaccine ultimately saved and continues to save, as the pandemic broke out, there was a very noticeable decline in children getting vaccinated for measles, from about 97% in 2020 to 94% last year. That's according to the CDC.
Now, hundreds of people, mostly in the Southwest right now, have contracted the virus. There's at least one case in Vermont. As News Center Maine's Raya Wooten reports, doctors say there is something that links the two.
The cough, red eyes, and the key indicator, a rash.
I really thought that and hoped that I would never see measles.
Maine Health's Dr. Dora Mills first saw measles outbreaks early in her career when she worked in Tanzania, then again in the early 90s during America's national measles outbreak. But then the potentially deadly disease was eradicated in the U.S. in the year 2000.
And I was just shocked to see it.
And Dr. Mills is stunned to see it return. 25 years later, new cases have spread as far north as Alaska, as far south as Florida, even hitting northern New England with at least one case now confirmed in Vermont. Measles outbreaks in Texas and New Mexico are growing, with an unvaccinated child dying in Texas and an unvaccinated adult in New Mexico also dead.
And the tragedy to me is that this outbreak is primarily, entirely due to people not getting vaccinated. We've had just an epidemic of misinformation, and people are afraid of vaccines. Some people are afraid of vaccines, and yet it's one of the biggest public health achievements of the 20th century.
The World Health Organization and the CDC both say that if you have measles, you could potentially infect 9 out of 10 people that you come in close contact with.
The key thing you can do to prevent measles is to get vaccinated. Unfortunately, there isn't really anything else when it comes to an airborne virus that you can really do.
Doctors say without vaccination, the risks are high. In Portland, Raya Wooten, News Center Maine.
Now, Maine passed laws in 2020 that require parents to vaccinate their children before enrolling them in school, resulting in higher vaccination rates when compared to other states. Still ahead tonight, wrestling with a problem when it comes to girls who love one particular sport.
That's later, but first, being priced out of an insurance that many people need later in life.